Hey everybody, in this video we're going to be looking at acute respiratory illness, and I'm going to be mainly focusing on the management part. And I have to say that I literally went crazy trying to figure this one out because it was actually a really subtle change, but then I couldn't figure it out, and I take these kind of things seriously and I waste time, and it took me 4 hours to figure this out. Like, I am stupid. So I thought, why not let you guys know too. And even though I'm going to be only talking about the management part as usual, oh my god, I keep saying this word, it's my favorite word. And the notes that I've written is like solid. You can just read it and you can go and write it in your exam. So this ARI, we are only going to be looking at the management under IMNCI. IMNCI is Integrated Management of Newborn and Childhood Diseases. Illness. So why is it important only in children? Because this is a huge problem and it is a main cause of mortality when it comes to infants and young children. So that is why the whole program exists, and under IMNCI we are taught how to manage certain important childhood diseases like pneumonia, diarrhea when it comes to the PHC, so that we'll know how to deal with it, like when to refer or when to treat ourselves. And I'm going to be going over briefly on what is IMNCI is, and then I'm going to go over the classification of pneumonia and then a little bit on the treatment. Okay, so we'll see about the brief on the IMNCI. So this is that for you guys. So I know it kind of looks not legible, but okay, I hope I make it understandable. Okay, what is written here is in IMNCI the whole thing is actually divided into two categories according to the age. The first one is up to 2 months of age, and the second one is 2 months to 5 years. The kids that are under 2 months of age are called as young infants. They're not even kids, they're infants. And children who come under 2 months to 5 year, the protocol differs. So that is the main basic thing. And then they will tell us to firstly assess GDS, which is general danger sign, and then only you have to go to main symptoms. Okay, and then we have to assess their nutritional status, if they have HIV and other statuses, and then we go to their immunization status. And then after we have all this information, we'll classify them into 3 categories, that is pink, yellow and green. And pink is it should have been red. So pink is danger and you have to immediately refer, and yellow is the intermediate between pink and green, and it differs from disease to disease. And green is obviously go home, that is green. And there are certain things that comes with green, like come back if there's any problem, you have to advise them that, so that is green. And this is the basic thing about IMNCI. Now other things that you have to know is, what are the general danger sign? General danger sign includes the blue things that I've colored over here, and this odd looking thing over here is actually a feeding bottle. I know, you have to believe me. And I have put a cross over here, which means that the child is not feeding. So that is one thing. And the next thing is this is a brain, so I'm telling that this is related to CNS, and I've just written C over here, which stands for convulsions, because I obviously am not really good at drawing people with having seizures, babies having seizures, so I've just written C. And the other thing is person, and is it, which technically just means that this person is super sleepy. So what I'm trying to tell is that first general danger sign is the child is not able to feed properly, and the second and third thing involves CNS problems, that is convulsions and extreme lethargy, even too extreme for the illness that the person is that the child is experiencing. So these 3 things are the main general danger sign. And then we'll be including one main symptom. Okay, we are studying pneumonia right now, so we are including stridor over here. Okay, why are we doing that? Because In the update, we just include the general danger sign plus the main symptom, and we call it very severe disease or severe pneumonia. Like, they're not different categories. If a child has general danger signs alone, then the child is said to have very severe disease. But in the new update, if the child has general danger sign plus pneumonia symptoms, that is stridor, then we couple it together and we call it very severe disease or severe pneumonia. It is not like different. I mean, they're not separate. Okay. I mean, I should stop telling you how it was before the update, because it's going to confuse you guys. So just remember that in the classification of pneumonia, the severity of pneumonia, the first classification is very severe disease or severe pneumonia. They come under the same category. And what do they comprise of? They comprise of general danger signs plus a main symptom, that is stridor in calm child. And yeah, that's it. And then we'll move on and assess the malnutrition, the things that I said over here. Okay. So for the record, I'm only talking about the 2 months to 5 year category, because the up till 2 months category, the update was really confusing. So I thought just stick to the book for that one. So I'm just talking about 2 months to 5 years over here. And I'm just giving an overview. After I give the overview, if we can go to this table over here and we'll be able to understand. So this is how pneumonia, the severity of pneumonia is classified when it comes to the age 2 months to 5 years. Okay. So what I said earlier, very severe disease or severe pneumonia. Okay. And one more thing that we have to remember is these classification, the classification of severity of pneumonia is based on chest and drawing. Okay, so when it comes to very severe disease or severe pneumonia, there's chest and drawing, and if it's just pneumonia, then plus or minus chest and drawing, like it doesn't matter if there's chest and drawing or not. Okay, but there'll be fast breathing for sure. If there is no pneumonia, they won't have any chest and drawing or fast breathing. And the criteria for fast breathing is given above, okay? And it's just numbers, so you can go through that, and I've written it clearly over there, so no problem at all. So that is how we classify it, okay? So if we go to this table, we'll be able to see, and I have just, made some changes over here. That is the update. And so we can see over here that it's severe pneumonia plus or very severe disease, and the general danger signs are included over here. And in pneumonia, it's plus or minus chest and drawing. So that is a new thing. And in no pneumonia, none of them are here. And next comes the management. If it is very severe disease or severe pneumonia, we have to urgently refer to the hospital and give first dose of an antibiotic. We'll see later what that is. And if they have pneumonia, then that time also we'll give an antibiotic, but we won't be referring. We'll just advise a mother. We'll tell her when to come home. We'll reassess the child after 2 days. Now what can happen in that 2 days is what is given over here. Either the child becomes worse, like the child will go and experience the general danger sign and experience a very severe disease, or the child could remain the same, the condition could remain the same, then you're probably prescribing the wrong antibiotic. Then you have to change the antibiotic. Or in that 2 days, the child could improve. Then that is a correct antibiotic, and we have to go ahead and ask the patient to complete the course of antibiotic. And if there's no pneumonia, that time also we have to check if the cough is being chronic, like going for 30 days and all, then we have to suspect pertussis. And obviously when we are having, if it's a non-pneumonia case, then it's just an upper respiratory tract infection, and we all know that upper respiratory tract infection can cause ear infection and it can cause tonsillitis, so we have to treat all that. So that is the thing over here. Now we'll go to management proper. Please remember that we are only studying 2 months to 5 years age category. So very severe disease or severe pneumonia, before referring, we have to give injection chloramphenicol or oral amoxicillin. Now that is one of the update. The drug of choice now is amoxicillin. Okay. So, and also we have to keep in mind that we are only giving chloramphenicol for the ages 2 months to 5 years. We will never give chloramphenicol to young infants because they will develop grey baby syndrome. Okay. So we have to remember that. And these are the things that they actually have to get when they go to the higher hospital, the oxygen support, intensive monitoring, and they will be needing injectable antibiotic like benzyl penicillin and ampicillin and chloramphenicol. Remember, the drug of choice is amoxicillin, okay? And if they have pneumonia, whether or not they have chest and drawing, all you have to do is give oral amoxicillin and wait for 2 days and check them after 2 days and see how they're doing, okay? And for no pneumonia, what we saw earlier, just treat the other co-infections, okay, like the ear infection, everything. So that is all about 2 months to 5 years. The next thing is less than 2 months, and that is the same as it is in the book, because we'll just stick to that, no complications. So that is just very severe disease, severe pneumonia. Now notice that they have given it as two separate categories. Very severe disease is separate category and severe pneumonia is separate category, and no pneumonia. So for this, the management is simple. All you have to do is, if it is very severe pneumonia, you have to first give amoxicillin because that is a drug of choice right now, as of now, and then you have to refer. And after you refer, after they get there, they'll be getting benzyl penicillin or injection ampicillin plus gentamicin because it will increase the efficacy of ampicillin. And remember that we won't give chloramphenicol or cotrimoxazole for this, for children under 2 months of age. And for no pneumonia, we'll advise a mother to keep the infant warm, and we'll advise a mother about the general danger signs so that they'll return back. Okay, so that is all I want to talk about, and the whole notes is clear. Hope this video was useful. Thank you very much.